Thanks everyone for joining us for this panel on future of health tech. We have some amazing founder operators in health tech joining here, and I'm excited to be moderating this session. As a brief introduction, I'm a co-founder and CEO of a company called Basys.AI. We are based in Boston, and we work in reducing administrative burdens in healthcare using agentic AI. I previously co-founded a company called KY.AI, and I have done my undergrad degree in computer science, master's degree in health data science from Harvard, and I've also instructed at MIT. So on that note, let me quickly hand it over to our panelist, and we have Arunoday. Arunoday, could you please introduce yourself and your company?
Sure. I'm Arunoday, and I represent OHealth. So to describe what OHealth does, let me give you a scenario. When a patient enters a hospital, he's already in discomfort, and he's desperately looking for a doctor. Now, he does not know whether he needs a pulmonologist or cardiologist. He just wants to see a doctor who can give him the cure for his ailment. The process follows is that he registers himself at the desk, and then he waits for a long hours at the OPD. When he finally gets to see the doctor, it's hardly a few seconds, or maybe a few minutes, because the doctors are also hard-pressed. They have too much of work burden. I'm talking about the public health hospitals. And there's a complete dissatisfaction here because the patients feel that we were not completely heard of. I could not explain my problem well. And the doctors say, I cannot hear everybody out. I do not have enough time. If I start here giving 30 seconds extra to every patient, possibly about 100 patients will go back home without even seeing me. How OHealth comes in and adds value here. When the patient enters, they interact with our kiosk, or you can think of it as a platform. They talk in their native language. For example, if the patient is comfortable in speaking in Telugu, they will explain their health concerns in Telugu, and the platform will ask dynamically generated questions to get to know about the health concerns better. It then creates a clinically rich summary, which is shared with the right doctor. So it would also direct the patient to the right specialty. It will tell the patient which kind of doctor he needs to see. And when he actually gets to meet the doctor knows everything about the patient. The doctor would say, hello, Amber. I see that you've been having chest pain for the last 4 days, and it was very severe this morning. And I see that you took a paracetamol. Let me change the medicine and see me after 4 days. Now, in this situation, the patient is completely satisfied because what he did with the kiosk or with the platform outside has already been copied with the doctor. And the doctor does not have to go with the triage part of understanding and giving time to this patient. So it reduces the consultation time while improving the efficiency of the consultation drastically.
Absolutely. It's such an acute need, not just in India, but globally. And we have another panelist, Nitin. Could you please introduce yourself and the company?
Yeah, thanks, Amber. My name is Nitin Guru, and I'm founder and CEO at RX1 Care. We are agentic AI company or agentic AI solution or platform company for healthcare. First of all, before I begin introducing about my company, I must say that I'm honored truly to be in panel with such august speakers, as well as a great thanks to Mr. Karthikeyan and Dr. Sharma for organizing such a great event, and where we are talking about next in different domains. And while we are talking on the next in different domain, I think whatever technology or solution we build, it solves the purpose of trust. Right? When I say this, solve the purpose of trust, because most of the time when we talk about technology, we first see it with doubt, as it's happening with AI, right? And what we are trying to do is establish that trust using technology and AI for healthcare, right? And how we are doing is building a trustable communication infrastructure for healthcare. When someone communicate, as my friend was explaining, to AI, there's always a doubt, hey, I'm talking to AI, whether it's giving me a right answer or not. And that's where we want to solve that equation so the trust is established back.
Absolutely. And as we think about technology and AI and so on and so forth, I think trustworthiness, reliability, transparency are some of the domains that we should absolutely take a look at, and we should not be taking that lightly. And on that note, and on a more slightly positive and optimistic note, what are some of the areas that you're seeing, at least in your company, where agentic AI is acting as a catalyst? And we'll, of course, talk about the downside as well, but let's begin with the positive side.
Absolutely. So I'll give you a very good use case. So typically what happens when someone, say, book appointment to a doctor, right? They generally book appointment, say, 6 p.m. and probably they won't arrive till 7 p.m., right? And so in India, what happens is like you get a huge queue of patients line up, and the time you have booked is already kind of consumed, right? And then you still kind of being operating from your normal time, extending it, etc. So one of the things which AI does in our use case is kind of following up with the patient, right? Calling autonomously and then reminding them that, hey, your time is there. If you are not going to come within 1 hour, then we are going to allocate it to someone else, right? So that's where the efficiency and I would say that in terms of timeliness improves.
Makes sense. And I think as you think about different geographies, and all geographies have their own nuances, some are more on time or some are less punctual and so on and so forth. So that was an interesting example that you just quoted. And Arunoday, based on your experience, where you're seeing the technology being really helpful, and how are you finding it unique, let's say if you're operating in India or if you're operating somewhere else, and how is technology helping or enabling you for those deployments?
I think India is at a very sweet spot, because the adoption of technology, even if we feel that probably the bottom of the pyramid, which is the slowest in adopting technology sometimes, and especially when it comes to AI, we feel it's beyond their measure to even understand how to adopt it, is completely false. Because when it comes to adoption, they are the ones who are ready to experiment, probably with the reason because they have the least number of options, and they are the ones who are looking for a better way of reaching out to their destination. That could be probably ordering something through grocery or even reaching out to the right doctor. So when we come to this bottom of the pyramid, earlier when we introduced this technology, the question was asked, do you think somebody coming from a village would be okay with using this technology, would be comfortable using this technology, would be happy to talk to a computer, would be happy to even explain their problems? They would just brush it off and say, let me talk to the doctor, or make me meet a doctor. I don't want to talk to this. This was the ideas initially. But to everybody's surprise, these were the people who actually were very forthcoming in talking to a kiosk or platform. They said, okay, at least somebody is there who's asking me questions. This is brilliant. Because the public healthcare system is a little different in India. Patient load as well as the disease load is ever increasing, but our infrastructure is limited. The number of doctors are even more limited. We are trying to use digital tools to bridge this gap to make the process more streamlined. And these are some of the solutions which can actually play a great role.
Absolutely. And technology being an enabler, when you're founding a company, many a time you have constant doubts about all the time you are invalidating the hypotheses. So when you actually come across a hypothesis that works, I think that's the goal for us founders, I guess. On that note, and on a more measured perspective, let's also talk about some of the things that keep you up at night. How about we begin with you, Arunoday?
Well, India is an ensemblement of not just technologies, but also languages. And language is a very important, critical aspect of our tool which we are using. When you think of one state, it's not just one language. It's not that easy. In one state itself, there are several dialects and several tones and several nuances and even several terms for many diseases and the way to express themselves. We constantly keep on working and training our models so that we don't miss out even on a single medical information which is shared by the patient, because that's very critical in the journey of his diagnosis. That is something which we are very, very critically working on. And if you have to ask me what is something which is keeping us up, is that we keep the entire team up in the training of the languages, and I think we are succeeding very well on that.
That's amazing. And Nitin, what are your thoughts on that?
Yeah, I think on similar line, I think if I talk about the same thing in terms of data, right? So how we capture data, how we make sure that data quality and sanctity is maintained, because ultimately for all these agentic AI solution, the context is the king, right? And without proper context, it might result in misleading kind of information or misleading kind of actions. And that's where I think if you ask me in one word, data is something which I'm very much concerned about and passionate also about, that how we make sure that data quality is maintained.
And that's a very valid point. When you think about AI is garbage in, garbage out, data quality has to be the top quality. And many a time when you're operating in certain geographies where data might not even be digitized, I think that further adds on the complexity that you're talking about. And given that we have very focused session, my last question to you both will be, what is something unobvious, let's say, that you have learned in the past couple of years, months, etc., while you have worked on your company, and what advice would you give to other founders as they think about operating in health tech?
Sure. I think there are so many things which I have learned in my entrepreneur journey. But if you are working in healthcare, right, it's a very complex kind of game because you are dealing with the lives. So everything you do, you have to make sure that it is 100% accurate, right, and to the point, and then only it will make a difference for the people. Right, so accuracy is something which I would say that keep in mind all the time. And then also, if you ask me, like, what I've learned is, in India, people will imagine that in rural India, people not using internet or such that. But I came to know about that 590 million people in India, 95% are now already have access to internet, they are using internet. In fact, rural population is using internet more than urban population in recent years, right? So that's where I think now they have the access. What kind of tools and solution we can build for them so the citizen benefit or from these healthcare solutions? So that is the critical aspect.
Absolutely. And what do you think about that, Arunoday?
Well, I'll tell my fellow strugglers that, it's something which is not like the conventional businesses which we had earlier. It's not something which you just need perseverance with, that, you set up a factory and then you just wait and you're doing your bit and, have some patience. You need to evolve overnight. You have to be up to the point. You have to, be up to the new technological developments. Otherwise, you will be, even if you're not making money, even if you're not making any success, just by having patience will not work out. And secondly, I think there are a lot of tools in healthcare which are there, but I feel the most important would be something which can hit the bottom of the pyramid. Because the adoption of AI in India is quite mimicking the economic pyramid of India. So the top of the pyramid, which is the rich, are the ones who are engaging the most. Probably not just because they have a lot of exposure, but also because they are concerned about their income streams and they are interested in also in understanding how they can make more money out of it, which is very logical. The mid is, of course, more, they're in the mid of the AI buzz. So they are worried about AI taking up the jobs, and their consumption is pretty low. They're mostly using AI to give some commands to get some results like Google or get some images generated. But the bottom of the pyramid is the one where if they accept AI in healthcare, then the transformational innovation would happen. And these are the ones who we need to target. We need to create tools and solutions which they can adopt and they can use to get better access to healthcare.
Absolutely. Some words of wisdom coming out from our panelists, and I feel that kind of brings us to the end of this panel. In summary, what we discussed, healthcare is a very unique domain. And it begins with transparency, empathy, reliability, and so on and so forth. And as you think about health tech, there are so many things that can go wrong. We also talked about the use of agentic AI, how we are deploying them in different geographies, and all these geographies have different nuances and so on and so forth. And then the final conversation, which was around when you're founding a health tech company, being consistent, being pushing at it is the mantra. So thanks so much for joining us for the panel, both of you, and thanks so much, everyone, for being here on the panel as well. Thank you.
Thank you.